folks here. I want to honor your time and go ahead and warmly welcome you again. My name is Lori Clark, and I'm the director of the Social Policy Institute at San Diego State University. And my team is here today with the Ventura County CPP implementation team and ICPM. So the integrated core practice model is the blueprint for system and practice change in Ventura County. And so we've come today to share some of the innovation, insights, and lessons learned that this team is encountering along the way to that. And so let me show you, let's put up the slides and I will show you who all will be presenting to you today. And so we have, on the next slide, please. All right, so Katie Rhodes, Chris Ridge, Savannah Eden, and Director Melissa Livingston, who I will introduce in a moment, are all from the Ventura team, and joining me is Clorinda Marino and Angelica Oberleitner. So with almost 1,000 people on this statewide convening, we wanted to get a sense of who's in the room today so that we can tailor our remarks for your interest. So we're going to do a quick Zoom poll, and there's going to be 3 parts of it. So we're going to ask what part of the state you're calling in from, what your role is, and then how familiar you are already with ICPM. So let's go ahead and launch that poll. All right, so just click your county and then scroll down to part 2. Is everyone seeing the poll? Okay.
If you need to make it bigger, you can click on the little square in the upper right-hand corner because it's a little small, I think.
And Lori, it's set up as 3 little polls, not 3 in 1. So
Okay.
The question is first.
Great, thank you. All right, we'll give just another moment for folks to weigh in there. All right, let's go ahead and close the poll. The good news is we have representation from all across the state. So we're most heavily represented. Almost half of you are our neighbors in Southern California, and about a quarter of you are from the central region. And then a great representation from our partners in the Bay Area, Mountain Valley, and Northern. So thank you for that. Let's go to the next poll and find out what kind of roles you represent being here today.
Do you see the poll?
I am still seeing the former poll.
Yeah, the share results.
Right, this is
Okay, let's not get bogged down in that. We're just going to kind of do a little bit of an old-fashioned thing. We can't do your roles this way, but when you make comments and contribute your ideas, which we welcome you to do, introduce yourself and tell your role. But meanwhile, okay,
I think we've got it. It's a little tricky to, yeah.
Go ahead and take a moment to weigh in on this poll.
Hello. Angie.
Okay, we'll give just another moment for a couple more folks to respond. Okay, thank you. Let's go ahead and close the poll and we'll share results here. So I hope you can see that, again, we have a very nice balance among folks who work directly with children and youth and families. We have supervisors, managers, and directors, county leadership and administrators, as well as capacity building consultants and some other folks as well. I do wish that we had the youth, parent, and caregiver expertise represented today, but rest assured that we do through this work. All right, so the final poll is, how familiar are you with ICPM already? We wanted to get a sense of that. Okay, so either mark, I'm extremely familiar, I already utilize it in my day-to-day work. I'm somewhat familiar, I've seen a few presentations, but not yet implementing. Or I'm not very familiar. ICP, what?
Just a quick interjection for folks to have their microphones muted if you can, unless you're gonna go ahead and unmute and speak to the group.
Okay, thank you for weighing in. We'll go ahead and close that poll, and I want to share the results. So what a pleasant surprise. Almost 15% of you are extremely involved in utilizing ICPM already. So I know that that's folks other than Ventura County as well. And we have heard of other partners doing great things with your implementation and hope to hear from you today. Well over half of you are somewhat familiar, but not yet implementing. And then about a third of you, not very familiar at all. So I'm hoping that as we make our comments and remarks and share with you today, that we can help everyone on the call either to affirm and strengthen the implementation that you're already doing, or to make some informed decisions about the fit of ICPM for you and your locality. All right, so without further ado, it is my pleasure to introduce Melissa Livingston, who is the director of the Human Services Agency in Ventura County. Melissa is also the convener of the all these ICPs and letters. She's the convener of the interagency leadership team and has done a remarkable job of really bringing teams together and has given such tremendous support to the work here. So Melissa.
Thank you so much, Lori, and thank you everybody for allowing me to spend a few minutes with you this morning. It's an honor and privilege to spend time talking about our wellness work in Ventura County. And as Lori mentioned, I'm a member of the integrated leadership team, which started with 4 core partners: our probation partner, our education partner, our regional center partner, our behavioral health wellness partner, and our human service agency, social services, child welfare partnership. But as we've begun this work and begin some level of the transformation toward moving toward implementation, we've added additional partners to our mix: our public health partner, our healthcare agency, as well as our managed care plan. So in Ventura County, we are very proud of our track record, though. As leaders in innovation and system change, we've cultivated many mutually respectful and beneficial partnerships across our continuum. And our wellness system work is grounded in equity and access to services, supports, and opportunity for all Ventura County children, youth, and families to be resilient and thrive. Maximizing wellness and quality of life for all requires co-designing our wellness system in concert with and in alignment with our public and private partners, community providers, through listening to and uplifting the voice and choice of youth, parents, and our caregivers. So this first slide is a depiction of where we're starting our work. One of our most challenging areas that historically has had a significant amount of disproportionality in its system. The Kamala McKenna neighborhood is our focus. And real quickly, bringing your eyes down to that first column of that 21.41% and the red arrow that's pointing there, what that reflects is that the poverty rate in that region is 3 times what it is in other areas in Ventura County, and twice as much as it is within the state of California. So no better place to start than one of the most difficult places as we do this wellness work in Ventura County. These disparate outcomes that have been going on in this neighborhood for some time and really highlight the importance and the call to action of equity and access, and our focus work as we proceed in transforming our systems and building out our wellness system. And before you, here is our wellness vision that was created by integrated leadership team. Our vision is going forward is to create a child, youth, and family wellness system by aligning government, community, and family stakeholders to maximize wellness and quality of life so all children and their families are safe, healthy, educated, and well, with a sense of belonging, purpose, and opportunity to achieve their aspirations. And in sharing this vision with our parent leaders in Ventura County, they wanted to co-design this wellness work with us, and they created their own vision statement, which is very much a nexus to the work that we're doing. They want to create a new system to help link county agencies with those in the community, where families feel safe and can receive support and education to get help with things they need when they need it, and with the goal of being strong parents. Go to the next slide. Yeah. So our work is really grounded in the theory of change. The theory of change is really very simplistic, but it's very powerful. If we align public systems and community partners for integrated whole child, whole family, and whole community care, then children and families will have equitable access to services, support, and wellness opportunities. And in turn, we will strengthen protective factors, address the social determinants of health, decrease formal system involvement, and increase wellness for generations to come. Most recently, our Ventura County Integrated Leadership Team made a commitment to the integrated core practice model, co-funding our integrated core practice model work going forward, which is truly going to be the secret sauce for leaders and practitioners as we do this work going forward. So at this time, thank you again for letting me join you. I would like to turn it over to Katie Rhodes to speak more to our wellness system structure, planning, and implementation. Thank you.
Thanks, Melissa. And you can go to the next slide. I'm Katie Rhodes. I am a program manager with Children and Family Services. And there's a lot of text on this slide, and to go into it in depth would actually be a different presentation in our governance structure. So just a couple of things that I want to point out to highlight the overview of what we're doing in Ventura County. As Melissa mentioned, we have several different agencies involved, and that's because in 2018, for those of you who aren't familiar, there was a piece of legislation passed, Assembly Bill 2083, that created in the state of California, every county was to band together to create a children and youth system of care. And we were to write MOUs, memorandums of understanding, with at least 5 system partners. And Melissa mentioned some of those, but just to make it explicit: Child Welfare, Regional Center, County Office of Education, Probation, and Behavioral Health. And for our MOU within Ventura County, we decided that the model that we were all going to share of how we were going to work together and how we were going to use a shared language and values and so on and so forth would be the integrated core practice model, ICPM. So that's how we get to this slide. And our governance structure for this wellness system that we're creating in response to 2083 has these 3 components that you see, with the Interagency Leadership Team, the ILT, the Wellness System Planning Committee, which is the main one we're going to talk about today, And then we also have a wellness system collaborative that is more of the community partners and parent voice. We can go to the next.
Katie, this is Lori. Your voice is a little bit wobbly on the mic connection that you have. I just wanted to make you aware in the event there's anything you can do on your end to help with that feedback. Otherwise, we're able to make out what you're saying, so please go right ahead.
On a scale of 1 to 5, how wobbly? 5 is the worst.
About a 2.5 to 3.
Okay, let me switch microphones and know me again if I don't know if this is better or worse.
Much better.
Much
Thank
better.
you. Yes.
All right, thank you.
We don't want to miss what you have to say. I know it's good.
I'm glad you interrupted. I think we can move to the next slide. So the Wellness System Planning Committee really focuses on our operations and implementation, as opposed to our leadership, right, which is overall governance. And within the Wellness System Planning Committee, we took all the tenets of AB 2083 and we put them into the 4 different categories that you see here in the blue on the top of the table. And then we picked a priority to start with to implement the wellness system. And for our practice priority, we're focusing on ICPM. And so within the Wellness System Planning Committee, we have time-limited work groups. Sometimes time-limited means 2 years, which is the case right now that we've been working on ICPM and mostly focused on training. And so the last point that I want to bring up here is that we decided as the county we needed additional help outside of our county. And so we partnered with Richard Connect and the Social Policy Institute out of San Diego State University. And that's Lori, who you've heard from, and her team, to help us write a curriculum, hold a leadership launch, and really get started. You can go to the next slide. And really what I'm wanting to stress here is that ICPM is the foundation for both the system and the practice changes that we're going to make in the wellness system. And what we all decided on is that we want to move from focusing on harm reduction and really focus on healing. And thus all this language about wellness and health and healing, to move from not only being, again, trauma informed, but to also help people be well. And you can move on to the next slide. And so what will actually be different? And this is one of the main questions that our participants ask us in training. And we try to focus on system changes. And then the next slide, don't go there yet, but the next slide will focus more on practice changes. And we find that depending on the audience who we're training or engaging with, you usually gravitate a little more towards one or the other. So there's about 50% of us here today that are in more of a leadership role. And so as we continue implementing ICPM, we're going to see some here examples of adaptive system changes. We're at a significant reduction in family separations in Ventura County as one example. That one's more focused on child welfare, but recently, for the first time, we had nearly as many cases that were in our family preservation program, where they're still at home, they're not formally detained, it's a voluntary program, as we had in detentions. And that's just a significant shift. And you see these other examples here. And the idea is that we will be sharing our finances, we will be sharing our human resources as well. One other one that I want to highlight before the next slide, you have increasing behavioral health and school partnerships. So we actually have wellness systems as a result, wellness centers as a result of a formalized partnership between our county behavioral health and our county office of education, and then several individual school districts where there's a safe space, an actual physical space that's been constructed in several junior highs and high schools in the target area that Melissa was talking about, the one that has that disproportionate outcomes. And child welfare has gotten in on some of this action, and probation involved youth are there as well. But child welfare has used some of our block grant dollars from the Family First Prevention Services Act to go towards this. And so that's just a practical example of how we are trying to live out what we're saying. You can go on to the next slide. So again, our audience often wants to know, well, what does this mean for me if I am a a teacher, a probation officer, a public health nurse. That's all well and great that my bosses are going to be sharing money and such, but what does that actually mean from our practice shift? And I talked a little bit about that idea of moving from prevention to wellness, neighborhood place-based practice, where we are very specifically targeting different neighborhoods, the schools that are there, working with our community-based partners such as First Five to make sure that where they're located is an area where people can easily reach them by public transportation, even things like food distributions, right? So all of that we're working on, and that affects all of the people who are out in the field. And of course, relationships on authentic partnerships. And the last thing that I'll briefly say before I turn it over to our championships is just an example of this practice shift. Most of us on this call will have attended a child and family team meeting, a CFT, and we had one a few months ago in which the team was united in its recommendation. There was a teenager who had experienced an assault on a school bus. She was a child welfare youth. She was also probation affiliated, and she had a right to continue going to her school of origin, and the school was providing transportation on the bus, which is great. So everyone was doing what they were supposed to be doing, but she refused to ride the school bus. And so she was refusing to go to school. And it was no one's job to specifically help her with that need. No one was actually responsible, but we had her behavioral health clinician at the CFT, we had her probation officer, we had her child welfare social worker, we had people from the school, and everyone agreed that what we should do is provide her door-to-door transportation. And so long story short, many conversations and meetings and phone calls, but it was actual practitioners who were in that meeting, and they gave the recommendation upward. And those of us in leadership talked it out. And we decided that even though it's no one's particular responsibility, we have all agreed to work together for this ICPM model and to share our dollars when we can, to share our staff when we can. So in this particular case, child welfare ended up using some funds, and we used a contract that we had for transportation, and we paid for the rest of the school year for her to be able to go door to door. So we give that example to help empower our staff. And now I will turn it over to two of our ICPM champions. You will hear more about, they were part of our first cohort of Train the Trainers, because we got some technical help and capacity building through the Social Policy Institute to help us with this first cohort of Train the Trainers. And it's Chris Ridge from the Ventura County Office of Education and Savannah Eden from Ventura County Behavioral Health.
Thank you so much, Katie. Can everyone hear me? Hello, good morning, everybody. Thank you so much for being here. Happy to be here. So before we jump into this beautiful slide that I love so much, let's first, we'll go ahead and drop the question in the chat, but I'm going to invite you guys to take a moment and think, what are the most common challenges that you see that your families that you serve in your practice, what are the most common challenges that they face when it comes to traditional county services? Just take a moment, feel free to, you can come off mute or raise your hand or just drop your answers in the chat. Thank you, Tracy. Yes. Okay, not enough clinicians, staffing, red tape to access services. Ashley, thank you. Okay, wow. Okay, yeah. Staffing and timely appropriate placements. Yes, yes, yes. Authentic support for parent voices. These are all really fantastic. Would anybody mind coming off of mute and elaborating a little bit? These are great responses, and I'd love to hear if anyone is willing. I don't want to.
Hey, this is Justin from Casey Family Programs. I support.
Hi, Justin.
Hey, how are you? I support work in Los Angeles, and I put in there access, awareness, and even whether or not the services are what they want or need. And I've found just in my history working in child welfare and then also working with the county, we talk about code design, right? But often the county structures and the federal structure and the state and how it all comes down to the county level, you have so many parameters and restrictions, and we're often giving folks services that maybe they don't even want to access. And I always make and then we make it really difficult to access and
Yes.
understand and be aware. And I always give the example of, if Pepsi or Coca-Cola is going to put out a new product, they're going to do research and development. They're going to engage with customers. They're going to spend millions and millions of dollars. And in child welfare, like even if you think of family first, right, we kind of get direction and we push out different evidence-based practices, some of which don't resonate with folks in the community, or they have such a high barrier of entry for a small community-based organization that people trust in their own community to actually implement them. And so it's really, I think, in Los Angeles, talking a lot about that mindset shift that's needed and how the county partners with community and how we actually meet folks where they're at and then develop services and supports that work for them and not the other way around, services and supports that fit into our county structure or our federal or state sort of structure. Easier said than done, but I think
Well, that was
worthwhile.
beautifully said. I mean, I feel like you could just present the rest of this presentation. So yes, that's a great segue. Thank you so much, Justin. That's exactly kind of what we're looking at, with ICPM making that shift. So in this particular, and thank you so much for all of you that responded. You probably noticed a theme here in a lot of these responses. And really what we're looking at is these traditional county services are fragmented, right? So we have the family, and I just really love this visual. You have the family, yes, they're in the center, and you have all of these services that are kind of on the background, right? And they're like, we're over here if you need this, and we're over here if you need this. You just have to do this and fill out this referral form or go get a referral. And then as a result, what happens is that the burden of obtaining and acquiring necessary services is placed on that family to navigate themselves. And that's one main thing. The other main thing that we notice is that it's it's relatively easy to fall between the cracks and to fall between these gaps. And a very quick example is, let's say a youth goes in and receives with the school psychologist within the school setting, receives an IEP evaluation. And during that evaluation, that school psychologist says, I think, here are the results of the IEP and services. We also believe that mental health services would benefit your child. And then what happens? Now the family needs to go and seek out those mental health services, and they call this number, and then they're directed here, and it gets exhausting and they get confused, and now they're maybe not linked with those services. So on the next slide, if we want to go to, if we can go to the next slide, thank you. So this is a perfect way, perfect, I just love these visuals. You notice that when you think about the previous slide and you look at this slide, what happened is all of these entities and agencies and whatnot and scopes came together. They blended together to become more whole. There aren't gaps necessarily that you see here. And my favorite part about this, the child and family and the team of the child and family, so natural supports, other family members, relatives, have been brought front and center. It's as if we're now holding them up versus standing in the background and saying, you know where to find us if you need services. It's more of, well, no, now we're going to actually help you navigate it. And we're going to work together in our own professional scopes to make that happen. So in the next slide, in other words, and this is kind of linking back to what Katie was saying here, with our wellness system planning committee and circling back to what will be different is we want to look at, we start with our interagency infrastructures, right? So we're looking at what's taking place between our agencies. And then we can pull in ICPM and we pull in these shared values and these core concepts and components and our standards of practice. And we all kind of come together around this model. that is, of course, grounded in family engagement. And that is such a huge, important component, exactly kind of what Justin was saying, what Katie's touched on. You'll hear a lot of this. It's part of our principles and values that we'll get into later. When I say our, I mean ICPM. And it has to be absolutely grounded in family engagement and voice and family voice and choice. And with all of that, we will ideally get these improved outcomes for our children and our families and our community. And with that, I'll go ahead and pass it over to Chris.
So we're going to take a moment now to talk about the common language that unifies us and that really provides definitions on how it is that we do the work. And earlier in the presentation, you saw Ventura County's vision for our child, youth, and family wellness system, the vision that was represented there that really began in our examination of the language that you see represented here in front of you, which is from the Substance Abuse and Mental Health Services Administration. And what I'm going to ask you to do in looking at this language is to identify the word or words that represents the movement from program-centered into person-centered, because that was so much of an integral part of the initial discussions around Ventura County's initiation of this ICPM model. And so I'm going to read it to you briefly aloud here, and then invite you into the chat with word or words that represent that movement from program-centered into person-centered. So this definition is the definition of the system of care from SAMHSA. A broad, flexible array of services and supports for a defined population, organized in a coordinated network, integrating care planning and management across multiple levels, is culturally and linguistically competent, builds meaningful partnerships with families and youth service delivery, management and policy levels, and has supportive policy and management infrastructure. And so just asking and inviting you to chat out what it is that stands out to you that represents this movement from program-centered into person-centered. I see flexible being represented there. And we're keeping an eye on the chat. And integration, thank you. Flexible partnerships we see represented. Culturally and linguistically competent, meaningful partnerships, culturally competent partnerships. And meaningful. And thank you for what you're representing in the chat there. We'll continue to look at that, seeing a few more culturally competent, supportive policy, supportive with exclamation mark. Thank you, Valerie. Integration, flexibility, meaningful, coordinated service delivery. Thank you for that. And so that was the underpinning for the language that really formed our common and collective what we're going to see represented here shortly in our values and principles and our collective practices that we'll see coming up. We'll go ahead and move into the next slide and look at how it is that this ICPM common language was developed for all of the child serving systems that you see here represented at the bottom of the slide, and how it is that we began by discussing, well, what practices, what shared practices and behaviors are we looking at? What shared principles and values will we establish? What approaches will we have? And what are the theoretical concepts and underpinnings? So it was important to develop those common understandings from the beginning. Now, for those of you that have been in child serving systems for a while, you may be familiar with some of the language that we're going to see represented coming up. So, for example, through various initiatives such as the continuum of care reform or wraparound or child and family teaming, those initiatives have developed for us some language that serves as a guidepost in how it is that we do the work. So it may seem familiar to you. What we're looking to do is really broadly across all of the partners and all of the participants within our county of folks that serve families, children and families. We want to build that common language, and that's what it is that we're going to be looking at next, because in building that language together, it's going to really guide us in how it is that we can avoid duplicating efforts, and how we can avoid also pitting one effort against another, how it is that we're placing competing demands as sometimes systems do upon families. So we're looking to be thoughtful in how it is that we build this system that describes how we do the work. And so I'm going to pass the baton now back over to Savannah.
Thank you, Chris. Okay, so this is a very little bit of a deeper dive into the components and values of ICPM. But if you want a real deeper dive, I suggest attending a training, because that's when we'll really kind of, pull this apart and get even deeper into it. But right now, as you can probably see, these 4 values: parent and youth driven, community-based and least restrictive, culturally, linguistically, and equity competent, prevention and early intervention focus. So a lot of this language you're all probably more or less familiar with. So just to kind of briefly define these, parent and youth driven is as it seems, it is driven kind of the voice and choice, the parent and youth voice and choice, the treatment planning, the goals, a lot of that. I mean, really the idea is that it's driven by those that we're serving. Community-based and least restrictive, I'd like to say, everyone can, it's always room for improvement, but I do believe Ventura County is moving in an excellent direction in this sense. While clinics might have an 8 to 5, 8 to 6 schedule, we have a lot of 24-hour services, like it just, 24-hour availability for services of mental health capacity, healthcare, we have culturally linguistic and equity competent, and then again, prevention and early intervention focused. So I want to throw this out here without getting too, I'd like to hear from you guys, and just pause for a moment as you look at these values, and kind of land on one that maybe sticks out to you. And ask, I'd like to ask you how it's already either showing up, it's already showing up in your day-to-day work, or maybe you landed on one that you feel it could better inform your day-to-day work, or how so using more of that might improve the practices that you're implementing. So to repeat that very long question I just asked, land on one of these values, one that sticks out to you. How do you use it, if at all, in your current work, and or how would it improve or better the work that you do in serving the families? And you could raise your hand or put it in the chat. Okay, parent and youth driven. Lisa, would you mind elaborating a little bit on that? I don't mean to call you out, but if not, I understand. Can't unmute. Parent and youth driven. Okay. Yes.
I can try to unmute you. I don't know why.
Are we not? No, you can't unmute. Okay. Anyone else? Anyone else that's community-based and least restrictive? Okay. Prevention and early intervention focused. Justin, what do you mean? In what way would you feel that that's already part of your day-to-day, or do you feel that would be?
Yeah, I think there's a lot of work happening in LA that's really impressive in this space. And I know I'm personally supporting efforts like mandated supporting and also efforts to keep families together. And so I feel like there's just some really great work happening there.
Yeah. Yeah, I agree. I do. I see a lot of that are, early intervention, definitely, and prevention. Well, thank you. Thank you for that. So we'll move into our next slide.
So Savannah, I
Yeah.
want to just jump in for a quick minute. Thank you so much for giving us a little taste of some of the components of ICPM. We're not going to be able to cover all of them today. We'll show you quickly the principles next, and then we want to go to the shared practice model, spend a little time with that and with transformative learning. So let's quickly show the principles and then skip ahead to the shared practice model.
Thanks, Lori. So yeah, so these are our principles. There are, there are 12 of them. I suggest maybe you take a look and really see if you can connect them, not just to your work, but even your own personal values. That's one of the biggest things that I would say to take away from ICPM is that it's a model that is a shift in really how we not just professionally, but personally look at the services. I don't want to assume, but I do feel that we all have some investment on a personal level in the work that we do, and that's why we're all here. And I feel that, it's important in order to really kind of take away something from ICPM. It's important that we're able to really personally connect on some level with a lot of these principles and values. So, and then I think we move on to the next slide. Now, Lori, did you want to move past this one for time? Do you think that's probably best, or do you want to, should we touch on
No,
this?
I think just wrapping up the overview of the model, let's spend a few minutes on this slide and then go
Okay.
to the transformative learning.
Perfect. Thank you. Thank you for keeping me.
Just
I
a
get
quick
lost
note.
with time. Yep.
Do you want me to drop a link in the chat to the principal document?
Yeah, I think so. I think Angelica was hoping to share some, I believe so. I wasn't aware we were sharing a link to the actual document, but yeah, that sounds good. Thank you, Barb. Perfect. So these are the practice elements. I guess the kind of two main key components here. These are not ordinal. They are not phases. We don't move from one to the next, to the next, to the next. And while Justin was talking earlier, it made me, that he really kind of spoke on this, where it's a strength-based, person-centered approach, rather than looking into problem and service and matching. Let's find the problem and then let's match the service to the problem. And we're really just moving to more of an individualized, and this is ongoing. We're constantly assessing, we're constantly monitoring, we're constantly planning. And so I think that pretty much wraps up my piece, and then I will go and hand it back to Chris.
Okay. And earlier I'd spoken about how it is that we developed a common and collective language related to our practices, principles, and values. And now, and talked about how it is then that it really guided our work, how we work together. And we're going to talk about now what's called transformative learning that we heard Lori mention. That also guides how it is we work together. And in a nutshell, transformative learning is really taking our own past experience and reflecting critically upon it. And then from there, engaging in what we call a reflective discourse. So in other words, talking with somebody else, sounding board, so to speak, in examining that experience and that practice. And then again, critically looking at how it is that we might work differently to have better outcomes for children and families. And ultimately, that's where the action component comes into play. I want to invite the next slide to examine how it is that we began in talking about transformative learning as it relates to wellness, because we wanted to address wellness within our wellness system through the lens that you see represented here, that has on one axis challenge and on the other axis support, representing that a balance is needed for us to be in what we call that flow state. Too much challenge with little support creates anxiety, and vice versa. Too little challenge and plenty of support really puts us in a stagnant place. And so we wanted to define how we work together in practice through this model, so we could make sure to stay within a balanced and centered place, because that's ultimately where we feel that wellness resides. And so I want to ask you to reflect for just a moment here upon how it is that there may be domains in which you need support. My guess is if you're in a child serving system that there's plenty of challenges abound, but maybe just being thoughtful about how it is that support might be integral to the work that you do to put you into a place that is more productive and more grounded in a place of wellness. And so that's what it is that our transformative learning model does for us. And I'm moving into the next slide. We're going to conclude about talking in regards to relationships being transformed and really mindsets being transformed. I'll give you an example of that in a minute. But what we mean by transformation in relationship is really developing this empathy and understanding of one another as we work together, not power over, but power with, and also sustaining that engagement over time and sustaining that reciprocity in our work together, and from an inside out approach, as we call it here, working on first self and then before we begin work with others. And in mindset, we are moving from what we would call a compliance mindset into what is termed adaptive thinking. And I'd like to give you an example of that here. As an educator, I work at the County Office of Education. And prior to the pandemic, our model here within the County Office of Education had been to provide professional development, one of our core functions, by inviting folks coming on down here to our County Office of Education, a fine facility where we're able to provide world-class professional development with national and international presenters. And it's worked well prior to the pandemic. As you know, the pandemic changed many things for us. One of those is that people were certainly feeling exhausted and finding themselves challenged and full of challenge. They also found that they weren't quite as willing to travel. That's what we discovered. Folks weren't necessarily willing to travel from all corners of the county to come to professional development here at a centralized location. They didn't necessarily have the time to travel in the car during during the day or after the day. And one of the things that we found as an obstacle for us too is that we simply just did not have substitutes to be able to relieve folks at school sites to be able to come and attend training for the day. And so we rethought how it is that we're providing professional development. And we really found, as we listened to our folks throughout the county in our 20 districts and our over 200 schools, that what was needed is instead of folks coming to us for us to go to them. And so listening to their particular needs within their district and within their school, and literally going to those locations and providing that professional development in a concerted manner that was able to really focus upon their particular local needs. And so that's an example of adaptive thinking that I would offer for you as we move into our next slide and we challenge you with a few questions and reflection yourself, is really thinking about what will change within your work. Think of a change that you're looking to implement, and how could this concept of transformative learning help you? What might be something within this concept of transformative learning, this reflection upon experience, the reflective discourse with others as a tool to really form a new way of working and a new way of how we do the work. So I'd invite you into that. Certainly chatting out would be fine, and also voicing on with a few sentences to share about what might be helpful in transformative learning for you.
So Chris, I'm afraid we're going to have to offer that mostly as a rhetorical gift today to invite reflections, certainly invite any comments in the chat on this. This is really the meat of what makes ICPM different. It's the transformative aspect, it's putting it into action. And so now that we've given you a little bit of context for what Ventura as a county looks like, why they decided to prioritize ICPM, what ICPM itself is, and how transformative learning is a central part of that, we want to now peel back the layers and show you a little bit of the mechanics of implementation. It's going to be a high-level whirlwind tour. We're happy to share our slides and give you more information. We'll show you a tiny bit of data. We're not going to dwell on that. Again, it's available to you. We really want to get to the lessons learned and then preserve a little bit of time at the end. And thank you, Justin, for your resources on transformative learning as well. Everybody check out the chat there. So let's go on to the next slide. So needless to say, a program like ICPM, where you want to train everybody in the county, requires some rollout and intentional implementation. Ventura County decided to start with their leadership to do a launch and training, and this was an interagency effort across the board. Following that, it was decided that this would be a capacity building model. As much as Ventura County loves us and we love them, They don't want to be stuck with us forever to do the training for them. Rather, we are partners that build capacity, and along with Richard Connect, really designed to train the trainer program where not only would folks within the county have the capacity to train ICPM, but the best news of all is that the trainers are from different agencies, as you're seeing, and they go back and become local champions for all aspects of implementation and become a font of knowledge. So it's a win-win across the board. And then the other part of rollout initially was creating ICPM in action. And this is really primarily for supervisors and those folks who work directly with children and families. So this is ICPM on the ground. What does it look like? And what we're doing here, as you'll see in the next slide, is to create an integrated learning system. And so by that, we mean that we pay attention to all of these elements, but we're really scaffolding learning. It's not a train and pray, a train and run, a train and hope that practice and systems will change, but it's building in community of practice so that there can be ongoing talk with each other. So the child and family teaming has really benefited from this, because even by coming to the training, folks across public system agencies, community provider organizations are getting to know each other personally, know about what each other does. And that in and of itself has been a great facilitator of some of the interaction that you've heard already and will hear more from in the child and family teaming. So I'm going to turn this over to Clorinda to just give us a quick snapshot of what the Train the Trainer and communities of practice look like.
Thank you, Lori. And as Lori mentioned, capacity building has been a very important component of our training. And so what we have done, and Chris and Savannah are actually two of our trainers that are local trainers from different organizations, which has been a really special, I think, gift of getting to know each other and building our relationships that I'll touch on in a minute. But our Training the Trainer really focused on not only doing the training and helping them to see ICPM from kind of the background and how to train it rather than just receiving it as a participant, and then doing the training as well and doing some observations on our end and giving them some feedback. And then, as good implementation science says, we are doing coaching that will actually bring the knowledge and keep the knowledge flowing. And that actually brought them to the certification, and so that they could be certified ICPM trainers. And with that, definitely keeping that maintenance. As we all know, unless we keep working on the feedback that we get from the trainees and the participants, and we keep the knowledge alive, then many of our training efforts can be set aside. So in the next slide, I'll talk a little bit about part of the maintenance that we do with the trainers is having trainer meetings. But with the participants of the ICPM training, we have everybody come to the communities of practice. And again, that community of practice is that maintenance level of being able to have deeper dive conversations about things that we couldn't address at the training because we can't address everything. But this is where we personalize it to people's agencies. There's a lot of peer exchange, networking with one another, self-reflections, just active learning. And I want to focus on one of them who I think for me has been when we had one of our communities of practice. The people that came to our participants, our staff from the county, really wanted to do like a little resource fair. And so everybody says, well, we have all these resources, but we want to do the resource fair ICPM way. And for us, ICPM way meant really building on relationships. And I know Elise Jones this morning was very adamant about relationships and how important that was in that powerful opening session that we have. And I just want to emphasize, for us, it's been the same. In that resource fair, people exchanged not just a little handout and a pamphlet, which nothing wrong with that, but it was a name. There's a name and a number. Call me. I will answer the phone. And if I'm not the person to help you, I will refer you to the person that can do that. So this kind of exchange and relationship building has been very powerful in our community's practice. And so now you're probably asking, okay, so what's your reach and how many people have you trained? And so I'm going to pass it on to Angelica, who's going to give us that kind of more technical information.
Thank you, Clorinda. So you've heard now lot of things from the wellness system building to really the implementation and rollout. And so we want to talk very briefly about some of the data so that you really understand the scope of what Ventura County has been able to do over the last 2 years. We started off, as Lori put out earlier, in phase 1 to really engage more than 160 leadership staff from across the county, from all agencies. And about 2/3 of those went through some sort of ICPM training that was geared to leadership. And then as we started the train-the-trainer model in 2023, after developing the curriculum really specific to Ventura County, we were able to train the trainers and jointly with them train almost 120 frontline staff and supervisors, those who work directly with kids and families in the county. So when we develop a curriculum, we also build in the system of continued quality improvement, CQI, and we created a pre-post assessment as well as a feedback survey. And the data is collected from all the participants, and we build time for these assessments into the curriculum and into the training delivery. So the pre and post tells us if there is a statistically significant increase in participants' knowledge from before to after the training. And it really tells us if the curriculum works. And in fact, what we have seen throughout all of our trainings in 2023 is it's more than a 25% average increase from pre to post scores. And so we're very pleased with that. The feedback survey, of course, gathers input from the participants about training delivery, about materials, and about how valuable they think and they feel the training is to their work. So we collect also data from them about what are their main takeaways. And you can see on the slide, we have had really good responses. And the themes that we see in these open-ended questions are not surprising to us. They're really focused on the core of what ICPM is. They're focused on shared responsibility and collaboration, teaming, and the cross-agency collaboration. So before we wrap up and get to our Q&A and discussion with you, I'm going to turn it back over to Katie to talk a little bit about our lessons learned.
Right, so you heard a lot about the theory behind ICPM, and then just now the concrete steps that we've done to undergo our training and train the trainer to make it sustainable. Again, just for the scope, we are looking at training between 2,000 to 3,000 people over a total of 4 years. But the first 2 years have been slow as we were starting from scratch and developing curriculum and so on and so forth. And we think the big push, or we know the big push for training is coming up. So these lessons learned are at this point in time in our implementation. I just want to be very clear with that. We have not finished training all the people that we want to. And the most important thing was to have all of our leadership support at that leadership launch, which was a different sort of event from a 2-day training. And really was more around the theory, like what we're presenting to you today. And in addition to the heads of the interagency leadership team, we also had our county CEO attended and lent support. We had a message from the Board of Supervisors. And so all of the middle management and senior management who attended realized this is not just something that was checking the box for compliance with AB 2083, but this is something that again, countywide, and I don't just mean the county as an agency, but all of the partners, right, within Ventura County and their leadership have really advocated. 3 of the main pieces of feedback that we hear from all of the participants, both from the leadership launch and then from the trainings that we've been holding with these cohorts, have been how much they enjoy having local trainers as the presenters, people who are able to speak to their own experience on the ground, people who are full-time, working in these agencies. That it's, as much as we love our state partners, like it really means something when it's a local person sharing real life stories. People love the interagency, not only teaming of the trainers, because, for example, you might have a probation officer doing portion of your training, and then you might have Chris, right, from the Ventura County Office of Education giving you 5th grade riddles, right? What an awesome connection, but also everyone in the audience is from different entities. And like many of you, we spent like 3 years during COVID not seeing each other. And so people are loving the networking, the reuniting of some of their colleagues from other agencies, or meeting people from the first time, because a lot of us had promotions and turnovers during that time of virtual. So that is huge. People also love all the practical examples that we try to give, like real life stories, like the one I gave you about the CFT. That's here. You see the curriculum adapted to the county, but that's also our probably #1 area for improvement, because we are still in the implementation. So we don't have as many stories. So we're continuing to add on to the curriculum. And another thing that we're doing in terms of adapting to our individual needs is the consideration of the training modalities. We were doing the whole 2 days in person. We are going to be experimenting with an e-learning to do a portion of it. So particularly the portion that's more reflective and more theoretical will be taken at the beginning. And then the portions that are more around group work and discussion will continue to be in person and be interagency. And then finally, I think Lori and Angelica and Corinda did a great job about saying the trainer selection and capacity, but that is also a lesson learned, that each of our agencies identified someone who had a public speaking or a training background, but was full-time in another area. And it was an assignment for them. And yet people move on in their positions. And this is a 4-year effort. And it was yet another assignment. And so for some people, they just truly didn't have the capacity to keep doing these 2-day trainings, or they promoted or moved on. So we are looking at contracting out for some of this, but still trying to keep that core of the local people who are practitioners who will be able to come speak. So with that, we'd be happy to answer any more questions about the lessons learned at this point in time, but I'm going to turn it over to Lori to close this out.
Thank you so much, Katie, and thanks to the team for giving a really great presentation and I think overview. When you look at our PowerPoint later on, you'll see some additional thoughts about what ICPM has meant in Ventura County, and you'll also see some contact information. So we're going to go ahead and take the PowerPoint down so that we can talk to each other. And we'd like to invite your thoughts and questions at this point. We know that others of you here on the call are already implementing or getting ready to implement. We'd love to hear your experience as well. And also any questions or any items that we presented that you would like to follow up on. So feel free to either use your hand icon or just go ahead and come off chat and make your comment or question. So while you're engaging in transformative learning and critical thinking on your own part, I want to lift up Jason's question from the chat about how, in fact, Jason, here you are with a raised hand. Go ahead. I was about to channel you, but no need, you're here.
All good. It's Justin too, but people confuse me all the time. Except when Justin Timberlake was really hot in media, they never mistake me then. I was just gonna say the CFT question I'd love to hear more about, and then some folks are putting in the chat emails that I can follow up with. So happy to talk about that. I guess what I was wondering, from all your experience implementing, is there anything that you wish you did differently or something you learned around along the way that you're like, oh, if we would have done that first, or if we would have, sequenced this a different way, or done, any gaps you saw, just something to be aware of during implementation or planning for implementation?
That's a great question. Thank you. Let's go to Katie first from an administrative standpoint, and then we'll go to Chris and Savannah that you guys can weigh in as part of our champion trainers. Katie.
We roll the answer to Justin's question in with Lisa's in the chat, which Ventura agency took the lead on ICPM rollout, because I think they go together. We might have wished to attend differently. And that is, we had a work group, like I mentioned to you. I am the co-chair of that work group, along with Jennifer Dougherty of behavioral health. But one of the strange dynamics is that child welfare has the most funding for this type of work. And probation has some funding also. We're flush right now. I don't know if that will be the case, 3 months from now. And so we've taken a lot of the lead, although it's very much in teamwork. You've seen all the 5 million names and everything, but we are a small agency in comparison with some of our partners. And so that's been a capacity issue for us, right? So that we have the financial resources. We also are written into all the legislation. It's a compliance thing for us, but there's only so many of us. And I'm not sure if that wasn't necessarily a choice, Justin, or a design thing, but it's just the reality that I think a lot of people are dealing with. And one of our challenges has been to proactively engage the rest of our partners who don't have staff dedicated to prevention, who don't have funding dedicated to it. And yet, they have joined in with this MOU. And long term, if we really want to do prevention, child welfare is not the best leader, right, in this. So that's one thing that I would say. And then the second thing, and then I'll turn it over to anyone else, is that we have done a lot of back and forth in the tweaking of the modalities. Do we contract out? Do we do this internally? Do we do it as an e-learning? And our partners have been excellent. And, we do have a contract with the Social Policy Institute to help us with the design and the curriculum and everything. And that's sometimes what's hard about going first. If a different county had done this and then we had just copied what worked for them, I think it would have saved us a lot of time, a little money, but mostly time. And so we're still experimenting. And that's why we're at a point in time with you here today where I can't tell you which one is going to work best in terms of modalities. But what we did well that people love is truly integrating all 5 partners and then adding on public health, who is not required, but they're a huge hit and we can't imagine after them. I have a lot to say, so I'm going to stop. I'll put my email in the chat, turn it over to
Yes,
others.
so let me elaborate on Katie's for just a moment before we go to Chris and Savannah. I think the part of the conversation around modalities that I wanted to build on Katie's comments is about what constitutes learning that sticks. So it's not just doing a training, we thought long and hard about that before going to an e-learning. And we decided collectively not to go to that exclusively because the relational aspect was so important. And particularly with ICPM, where relationship is at the heart of the shared practice model. So we wanted the relationship to be on the table, part of what's practiced and learned and observed during the training. The other part that I'll scaffold into is it's awfully hard to say no to things that we're currently doing because something we've decided to do new is a higher priority when they're all great priorities. There are no bad priorities or things that are easy to kick aside, but we have found from trainers, from administrators, from others that unless there's a willingness to step back and have that conversation of what are we currently doing that we cannot do or delay or combine in order to take on ICPM or CPP or whatever, then it feels like a burden. It feels like something new on top of an already full load. So that's a current dialogue. Chris, Savannah, anything from your perspective in terms of a lesson learned that you'd like to add?
Savannah ran into some tech issues, I think.
Okay,
So I'll just briefly state that I'll echo the comments that you made in regards to modality, and yes, it is highly advantageous for us to, as local Ventura County folks, be able to provide the training, and it's also, you know, comes with some challenges of how might we do that, how might we sustain that effort over time, and so, you know, I think that is an important piece to look at. There's a high value on it, and also there's an investment too that I think is necessary to consider.
all right, thank you. I do want to recognize a question in the chat. If not CWS, who would be an ideal lead? And I'm going to take MC prerogative to say, you know what, any partner who has the passion for moving this forward, to capitalizing on this historic opportunity where we have resources, we have public will, we've got mutual regard across partners, would be an excellent partner. So please don't be at all limited in your thinking about that. It's going to be, of course, unique to your context. We've come to the end of our time together and want to just thank you so much for your active contribution. The chat has been very active. You've put a lot into that. So wishing you all the best in wellness and in your own transformative learning as we proceed forward together. So thank you, everyone. Look forward to talking with many of you again soon.
And thank you for the great presentations from the county and from our friends at San Diego State. Just want to let you know it's lunchtime, so you don't have to do anything. Leave your browser open, leave this meeting, go have a snack, run around, do whatever you need to do. And then at 12:35, we'll begin again. So if you pop in at 12:30, it'll give you a little time to find your afternoon workshop. So we won't be going into the main session. We'll go into our afternoon workshop after lunch. So have a great day. Thank you all so much for being here.
Thank you.
Thank you. Said I saved the chat.
Savannah, she's back.
Yes, I'm back. I don't know why, but it's all, I only have wireless internet right now. So that's been fun.
Well, you made it back in just in time to wave goodbye.
We can never understand the wily way of technology.
I know, you know, and it's always has the most impeccable timing.
Of course.
I mean,
of
I guess,
course.
you know, I thought I'm like, well, at least this didn't happen when I was speaking.
Right, that's true.
But it's just everything froze and I thought, oh, weird. And then, you know, I had messaged a couple others and were like, no, that's just you.
That's true. I know.
Think about
Well,
being a
glad you
classroom
could join
teacher.
again.
Yes, I'm back. Well, hopefully, I'll see how long it lasts.
I was just
All right,
going to
we'll
add,
see you
think about
guys.
being a classroom teacher and doing this every day and having tech bugs come up.
Oh, can you imagine?
It's just, yeah, when it's.
I'm going to say
repetitive,
goodbye since I'm signing off and driving
Bye,
to Ventura.
Corinna.
So I'll see you guys.
Oh, okay. All
See you
right.
then.
See you later.
Bye.
Bye.
All righty. Y'all have a good lunch.
You do
Thank
too.
you.
Bye bye.
Yeah,
Great
thank
job,
Thank
you
you,
guys.
Barb, for all your
Bye bye.
help.